Welcome to the YouTube channel of Royal Student Council. Myself, Dr. Mohammad Shahzeb Abbasi, the student 7th semester in Royal Metropolitan University. Well, the topic I'm going to present today is a captivating one. It's an autoimmune disease, SLE, aka systemic erythematosus lupus. To start with epidemiology, it affects around 1.5 million Americans, which makes up to the 1/5 of the total cases present worldwide. About the risk factors, it is to be noted that the Hispanic and African American women are more prone to it, and women in general, because women to man ratio is 9:1 for SLE. Now let's talk about the etiology to SLE, which is a multifactorial one. There are many factors that play part to it. It could be the genetics, environmental factors, or even the hormones. Let's start with the genetic one. And it is to be believed that one has to be genetically predisposed to have SLE. It could be the dysregulation of the components of the complementary proteins or interferons, which means no proper apoptosis happening in the body, leading to the cascade of immunological factors depositing into the respective organ, damaging them. What about the environmental factors? Well, it could be the pesticides, UV, heavy metals, polluted air, or there is such thing as drug-induced SLE, which we see in the case of antiarrhythmic drug procainamide, hypertension drug hydralazine, tuberculosis drug S1 cause drug-induced SLE. About the hormonal involvement, as I mentioned before, that women are more prone to have this disease in comparison to men. And why is that? It's because they have high levels of progesterone, estrogen, and prolactin hormones present in the body when they're going through the reproductive age, which is 15 to 40. These hormones exacerbate or augment the symptoms. In the field of autoimmune diseases, we use the two common terms, flare-ups and the remission. Remission is the time of period when the disease is sleeping, and flare-ups when showing the symptoms. Now about the pathogenesis and the pathophysiology. Well, it's a chronic autoimmune disease which involves a complex dysregulation of the immune elements. It affects almost all the major organs. In the brain, it can give stroke, seizures, and in some cases they also see neuropsychiatric lupus. In the heart, pericarditis is common. In the lungs, pleuritis. In the kidneys, glomerulonephritis. And also, it can damage the joints. Next in line is the clinical manifestation. What would be the signs and symptoms? For the cutaneous signs, for instance, there would be a malar rash, which covers the nasal bridge and goes around the cheeks. There could be a discoid rash, which can happen on any part of the body, including the scalp. What about the symptoms? The person would be having fever, weight loss, arthralgia, and in some cases even fibromyalgia, which cannot be diagnosed. So the person would be in immense pain if not managed well. About the diagnosis, so just like other autoimmune diseases, for instance rheumatoid arthritis, SLE cannot be diagnosed with a single test. There are a plethora of testing that can be done, starting with the CBC, which is complete blood count. In the complete blood count, they go for ESR. If it's higher, then the person is having inflammation. In the biochemical test, they go for the C-reactive protein. If it's higher, it means the person is having inflammation all the body. There are X-rays, CT scan, MRI can be done for the joints, for the brain, for the chest, to know if there is any pathological abnormality going on. There are tests that are specific to lupus, like anti-nuclear antibody test and the double-stranded DNA test. The double-stranded DNA test differentiates the lupus from other autoimmune diseases. Last but not the least, the treatment and the lifestyle. For the treatment, there are various classes of medications which have been used for the SLE management. Corticosteroids for the inflammation management, NSAIDs for the pain relief. For the lifestyle, one shall exercise daily, shall not consume sugars, gluten, omega-6 fats, and stay healthy. And that's all for today. Thanks for watching this video. Please like it and share it with your friends. And don't forget to subscribe the Royal Student Council channel. Just remember, be royal, stay loyal.